Or is it heavy? That's driver. Green button's on, if you're wondering that one too. Again, this also has a button that you can widen the legs. Go right in on the patient. And then you have these black little clips that just slide in right here, and you want to pull down and make sure that, oh, good spot. One thing that I have noticed with the lift is with patients with more soft tissue on their legs, you want to make sure that these are laying flat or they can cut into their soft tissue, or sometimes I'll lay like a towel or just some sort of pad in between the lift and then their legs. And then up here you have to control this piece, and it can go either way, so you're either sitting them up or you're laying them back down. So in order to get on, yeah. Lay back down a little more. And the blue, if you're wondering, is an extra large sling.
Perfect size.
Right.
Perfect size for Heidi. And you lift her up there, and then you can move her wherever you need to move her. Ta-da!
Are those slings like per patient?
They are now. And then when you're sitting them down, you just want to make sure that you can get their bottom back in check.
What other colors are there?
There's green, which is, yellow's the smallest, green, let me check, large, and blue is extra large. And if you're looking for the weight limit for your more bariatric patients, you can look underneath the battery pack for the weight limit. And you can put this sling behind a patient who is already sitting up in a chair. So the Sara Plus is really easy to use, and not used very often.
Can you talk louder?
Yeah, I can. So when you're getting ready to use Sara Plus, you're going to weave the gait belt through these nice little openings here. And then you'll come in, put it around the patient. If you're using the Sara Plus to transfer, you want to make sure that the foot plate is on. Sometimes you can also use this without the foot plate. If you want to very rarely help someone walk with this, you can. It's not really what it's used for, but you can take off the foot plate. Might lift up. And this can be detached. and then reattach it. So, use this. It's a 2-person lift. So you'll have the patient sitting up either in their chair, the side of the bed, and you'll have them lift up their feet. You can place them right there. On this, there's a button that you can widen the legs to get it properly placed. And then you'll come in here, and it's just a little knob, and you'll weave it through the green part. And then you literally just place it in the opening and pull tight here. Got that side. And then these you simply just lift up and then put them down, and then they're locked in place. To take it out, you just lift up and slide through. We'll tell the patient to hold on here. Make sure stand by the patient. You want to make sure that the brakes are locked. And then there's just a button on the controller to lift up. And then, wherever you're taking the patient, pull them out, spread them around, and then back to the chair. And then you'll tell the patient to sit with the lift and maybe to help make sure she's safely back in the chair.
Melissa, can I ask a question?
Yeah.
My patients tend to just always just kind of do this on that machine. Is it because they don't have enough leg strength?
I think a lot of patients think that when you're using a lift, they don't have to do anything. So I always tell my patients to actively try to stand with the lift. And if they are just kind of hanging here and the sling is coming up, then you might need to look at a different type of lift.
Sometimes I'll get the belt like under their butt a lot more. This purple thing really under their butt, even more like proximal thigh, and you get a lot more success.